Transforming Your Experience is Southwestern Sydney really looking at how it does its business. We've done some great things over the last 10 years in Southwestern Sydney, and we've got great examples of that. But what the staff and the patients are saying to us is that we could do it better. So some of the significant changes that we can make are around the consistency of our quality and safety systems. And that's very important for us as a district. Not only that, we want to really hear what our patients and our staff are saying about services, and we want to be responsive to that, and then building in capabilities for our staff to be great leaders in care delivery. So this is a huge opportunity for us.
Our patients are telling us that it's not just the medical treatment that is important, but it's every step of their journey. The way they find the hospital, when they walk into the hospital, how they're treated. They want to be treated as you would expect your closest friend or your family to be treated. That's what they want, and I think that's what we have to give them.
A positive patient experience to me would be where a patient could be discharged from hospital knowing that they have been heard and that they've been able to participate equally in their care.
Taking that little bit extra time to either talk to them or get to know them or really listen to what they're actually concerned about. If you bring them into it, they get that peace of mind as opposed to just being medically better, they feel better.
Patient experience is very important. They would like to be more involved in their treatment and what pathways they want to go down. So they like to engage with staff to have more information focused back on them so they can manage their health.
Providing compassionate care throughout the patient's journey is important to ensure that our patients actually feel that the care we are providing is individualised and patient-focused, ensuring that our communication is at all times respectful and ensuring that we're taking in the whole patient and their care requirements. I see us working to a future to ensure that the quality and safety of the healthcare that we provide to our patients is truly person-centred and individual.
One of the areas I believe that we need to work on is the transfer of care, the processes around transfer of care so that it is collaborative and that the patient is treated holistically.
It's all about the other elements that make up this person who is sick, and they might have certain cultural considerations that need to be taken into account based on their diversity. But it's all about ensuring that when the patient does come to this place, that their cultural diversity, whether it be based on race, class, gender, sexuality, religious beliefs, isn't going to be the driver of the type of service that they're going to get.
Good leadership to me is support. You support your staff and you're supported in the decisions that you make. It's also taking the time to get to know your staff, to ask them how they're going, so on a regular basis, and to communicate with them, to let them know that they're valued.
For me, it's about getting to know individuals and what their own individual learning needs are and supporting them. It's about being available on a day-to-day basis. It's about having formal structures in place to support learning. We need to focus on empowering our staff.
We've got all sorts of very, very exciting technological things, but they don't deliver individual patient care. I think the excitement is because people can see that they can work in these iconic buildings whilst delivering an outstanding personal service.
So it's really about a cultural change. I want Southwestern to be a health service that listens to the community, and most importantly, that is safe and reliable and consistent in the care that we deliver. This is our opportunity. This is our time to do it really differently and to take it to a new level together, not just the staff, not just the patients, but with our communities. And I'm wanting you all to be part of this fantastic opportunity.